The Together group are used throughout all aspects of the student programme. We use the Together group for interviewing students initially. The Together group, the service users really know what they want and what they want from care and how to be looked after and what they would expect nurses or healthcare professionals to be like. So they're a really good insight into, at a very early stage, of selecting the nurses.
In terms of within the actual curriculum, we use them to really come and talk about their experiences. So our Together group members are experts by experience. So I think it's really important that students hear from our Together group members their story, their journey, to help really develop their active listening skills, but also that person-centred approach that we want students to develop.
So we've invited members of the Together group to come along and teach on various modules in the programme. Some of those modules are to really sort of understand their experiences, really. So the module that I've asked them to come and contribute to the most is the Psychology of Health and Mental Wellbeing module. And in this module we talk about the experiences of health and well-being, and not just the physical aspects of that which they've studied in other modules, but more about how it impacts on them psychologically and socially, which of course the lived experience of that is really key to understanding it.
Following on from that, when we start deciding exactly what we're putting into the programme, what we're putting into the lessons, we quite often invite service users in to help us formulate the plans of the lessons themselves. They give us a really good insight into that. And then we bring them into module delivery, we'll bring them into specific lessons, particularly they're very useful with student nurses who have just started, who've never seen patients yet.
I have a health condition called multiple sclerosis, and I felt that I would be able to interact with students and help pass on some of my knowledge of my condition to hopefully help them in their future in dealing with other people with my condition.
So I've been involved in everything from course design through to interviewing potential students, as well as giving sort of human library experiences about what it's like to live with chronic health conditions, and publicising the Together group at different events.
I believe they get personal insight. You can't learn everything from a book. Basically, the patient experience is key, especially with something like Parkinson's, which affects everyone differently. There's no two people who will have exactly the same symptoms and exactly the same medication. So having a personal insight and seeing how much better I am now from pre-surgery to now, it really gives them quite a positive insight.
It stops sort of students and lecturers being in an academic bubble, I suppose, where they're sort of getting bogged down in theory and evidence-based practice and everything. It's all really good stuff. But sometimes you just need like a human insight. I hope that, because when they go into their professional roles, they often don't have much experience on the ground. So I hope that they take away some of those stories, some of those real stories that they've learned from members of the Together group that they've worked with throughout the time in university. And that there are times when they reflect on that, when it's relevant to them, when they think, I'm having a difficult time, this person's being difficult, but then they can remember, hang on, there was that time I spoke to somebody who was in that situation, and actually what was going on for them was this. And it might just remind them as they're going out there doing that job, just to remind them about the empathy and the understanding, and to have those values where they just sort of stop and think, how is it for that person? What is their experience of it, rather than what is my experience of it?
So the student feedback for any of our guest speakers is really well received. So on my modules, when I've asked them to evaluate what have been the best things about the module, it's always the guest speakers. And the reasons for that is because it adds to their understanding, it allows them to apply the information, it allows them to see what this looks like in real life. And for a lot of them, it gives them a bit of a an insight into what it might be like to work with people. So it really sort of prepares them in some ways to enter the world that they might be working in their future careers.